Hi everyone, I am Beatrice. In this video, we'll look at defense mechanism. So defense mechanism has to do with ways people cope with situations that are not palatable or something that is not favorable to them. The mechanism of adapting to it or coping with it. That's what we mean by defense mechanism. It can either be positive or negative. In this video, we'll look at the positive defense mechanism. In another video, we'll look at negative defense mechanism. So be sure to check it out. This video is part of psychiatric review. Now, before the end of this video, I will review some NCLEX type questions on defense mechanism, particularly positive defense mechanism. So stick around, let's begin. By positive defense mechanism, it means the mechanism the person is using to cope will eventually be of good interest to the person. So the first one is suppression. Just as the name goes, suppression has to do with you suppressing or you intentionally or consciously block an undesirable event, undesirable situation, something that is not palatable. You decide to block it or you decide to postpone it intentionally so that you can attend to it later because you want to attend to something more important. An example of this will be a student who is on clinical placement. Even if there's a situation that is not palatable at home, this student decide to ignore that, postpone it, and decide to focus on that clinical placement, which is more important at that minute. So that has to do with suppression. The next one is repression. Repression is like suppression. The only difference is that while suppression is a conscious effort where you intentionally block some unpalatable situation, in repression is unconscious. So you are unconsciously blocking those stimulus or blocking those unpalatable experiences. So an example of repression would be a situation where a patient has experienced a car crash or a very fatal accident, and now you are trying to interview them, they can't recall how it happened. Or a woman that has been sexually abused, but they can't recall how the event happened. That would be an example of repression. The next one is sublimation. So sublimation has to do with channeling unacceptable impulses into something more acceptable. An example of sublimation would be a situation where somebody that's very aggressive, instead of using that aggression on people, decide to channel that energy into something like boxing. That would be an example of sublimation. The next one is compensation. So compensation has to do with emphasizing on area of strength. In other words, instead of dwelling on area of weakness, you decide to put in more effort in the areas that you know you are very strong at or you can do well. An example would be like somebody of a short stature, let's say a boy of a small stature. He knows that he may not be able to do something that people that are tall are able to do, but decide to channel this energy because he knows that his own area of strength is academics. He can do very well. He decide to channel that energy into his studies and eventually becoming the top of the class academically. So that would be an example of compensation. You are compensating one area of weakness for an area of strength. The next one is substitution. So substitution, as the name goes, you are substituting something for something. So you are replacing unachievable goal with something achievable. Don't confuse it with compensation. In compensation, you are only emphasizing your area of strength. You are putting effort in the areas you know you are very good at. But in substitution, something you know that you can't achieve it at all, is not within your capacity. You now decide to replace it with something you know that you are able to get. Or you, let's say for instance, you went for an interview and the role, the position you are not qualified, and then they decide to give you another position and you decide to accept it because you know that okay, this is what meets your requirement. That's substitution. Another one can be you are supposed to be a professional footballer, but you discover that you are not that good in football. Then you decide to take the role of a coach because you know that maybe with being a coach, you don't need those skills that has to do with you playing on the field. So that's an example of substitution. Now the next one is intellectualization. That has to do with using your intellectual. That's using logic or facts to avoid emotional stress. An example would be in a situation where a patient is diagnosed with terminal cancer. Instead of expressing fear, the patient now decides to start making research about survival rate. Meanwhile, the cancer is already terminal. They are checking option of treatment, they are checking survival rate. They decide to keep studying that, putting all their energy into looking at those things instead of expressing fear or anxiety over the condition. So that's an example of intellectualization. The next one is identification. Identification has to do with imitating others that you feel that are doing maybe better than you, just so that you feel confident. An example would be a student imitating the instructor, the professor, dressing the way the professor dressed, talking like the professor, just to feel confident. Like somebody you look up to and you decide to start imitating them so that you feel more confident. The next one is altruism. So altruism has to do with meeting the needs of others in order to cope with a distressing situation. For instance, a man that has just lost his wife decide to volunteer in a hospice center to care for people who are in the hospice center. That's an example of altruism. They decide to meet the needs of others, even if that's the situation they just experienced. They want to see how they can cope with that situation. The next one is anticipation. So anticipation, as the name goes, you're anticipating, like planning ahead. So it's an emotional preparation for future discomfort. Let's say, for instance, a student is preparing for an exam. This student is already feeling anxious about that exam, but now decide to channel all the energy in studying and reading to prepare ahead for that exam. That would be an example of anticipation. Now, the last one is humor. So, humor, as it goes, has to do with cracking jokes, using comedy to express uncomfortable feelings. When somebody is not, the situation is not palatable to them and they decide to crack jokes about it. Let's say, for instance, a patient that has been diagnosed with cancer begin to crack joke about how they are going to lose their hair during chemotherapy. So, at that point, they are using humor to cope with that situation. Now let's look at some NCLEX style questions on positive defense mechanism. The first question is, a client who has aggressive impulses chooses to channel this energy by joining a boxing class. Which defense mechanism is the client demonstrating? A. Displacement. B. Repression. C. Sublimation. D. Projection. The answer will be sublimation. 2. A nurse chooses to put aside her frustration with a rude patient in order to continue caring for them professionally. Which defense mechanism is this? A. Repression. B. Suppression. C. Denial. D. Rationalization. The answer will be suppression. The next question. After losing his child in an accident, a man starts volunteering at a children's hospital. What defense mechanism is this? A. Compensation. B. Altruism. C. Isolation. D. Reaction formation. The answer will be altruism. The next question. A nursing student feels anxious about an upcoming exam and starts studying well in advance. What defense mechanism is being used? A. Anticipation. B. Repression. C. Intellectualization. D. Displacement. The answer will be anticipation. Finally, the last question. A patient jokes about needing a wheelchair after surgery, even though he is scared. What defense mechanism is this? A. Projection. B. Humor. C. Displacement. D. Denial. The answer will be humor. So that wraps us today's topic on defense mechanism, particularly positive defense mechanism. If you find this video helpful, please like, share, subscribe, and leave your comment. Thanks for watching.